This is a video showing a labral repair done in a case where there was over-resection of the proximal femur at the head-neck junction with the hip flexed and internally rotated. There's engagement of that over-resection area with the labrum and the socket, and there's a lot of motion with the labrum. This is thought to cause pain and likely cause re-tearing of the labrum. The key for this patient will be to avoid flexion and internal rotation so as not to engage this over-resected area. We can see when the hip is not rotated inwards, there's a good articulation with the head and labrum.
Yes, I've heard. Oh, no, you probably have.
But with over-flexion,
Alberta was involved in it.
the labrum is engaged and causing motion.